Before we start, let us pray first. Dear Lord, thank you for this day. I hope you will guide me in delivering this report. Amen. Now, for attendance, you may submit your attendance on a Google form link shown in the screen. At this time, I want you to guess the setting of the shown image. So correct, it's clinical setting. So good morning everyone, I am Deborah Shaniah Gopiao, and today I'll be discussing the clinical teaching. Our general objective today is at the end of the session, the nursing students at BSN 1B shall have acquired the necessary knowledge and competencies about the clinical teaching. So let us now get started to defining what is clinical teaching. Clinical teaching is a form of interpersonal communication between a teacher and a learner outside of traditional didactic scope that involves a patient scenario. In nursing, it is a type of group conference in which a patient is observed, studied, discussed, demonstrated, and directed towards the improvement of nursing care. In this case, we will discuss the different clinical teaching strategies and methodologies that can be used in clinical setting. First is the modeling. The preceptor demonstrates the skills with patients as the student observes. Modeling allows the preceptor and the student to act as a team through discussion of the case, development of diagnosis, and making appropriate recommendations. Next, self-assessment. Assess the students' strengths and weaknesses and develop their own strategies to make improvements. Late learners do this on daily and consistent basis, assessing skill to improve their performance. Next, coaching. The preceptor guides the student verbally through a test or procedure. The intent here is to keep the student safe and efficient with a technique they have not yet mastered. And lastly, feedback, the final strategy which is critical to the learning process. If no feedback is given, many students automatically think that they have not performed well. Without feedback, it is truly difficult for a student to make constructive change with their work. Now, let us proceed in determining the purpose of clinical laboratory. First is to get information about the health of a patient as pertaining to diagnosis, treatment, and prevention of disease. Second is to provide a safe, structured learning environment where students have opportunity to observe clinical practice and undertake closely supervised practice. Now, in preparation for clinical instruction, to ensure a positive learning experience for learners, educators must do a lot of planning before clinical instruction begins. Here are some tips that educators should consider. First is selection of clinical sites must be done methodically, so that to ensure that the clinical sites have the appropriate equipments needed for clinical teaching. Next, educators must consider the learning experiences that are available there. It should be connected to the objectives intended to learn by the learners. And lastly, the educator should make specific assignments for learners on a weekly basis, so that you can evaluate if the learner understands the lessons or needs an improvement. Now, in conclusion, teaching in clinical setting is important to optimize learning and maximize student engagement. Learning activities in the clinical environment should be planned, structured, and aligned with the curriculum and assessment. By observing and providing students with accurate feedback, the gap between actual and desired performance is narrowed. This is my reference. So in case you have questions, just ask me. And lastly, for evaluation, access the Google form link shown in the screen for the quiz.